Hey guys, Dr. Pete here.
It's Dr. Carla.
Welcome back to CHIRO Coffee Chats. And today we're going to be talking about something that comes up a lot in our practices. Dr. Carla, tell our viewers what we're going to discuss.
We're going to be talking about nerve compression, or better known as what everyone kind of calls it, pinched nerves.
Pinched nerve, yeah.
Yep.
And sometimes that's an accurate thing. And often though, when people use it, it's not. But why don't you describe kind of an actual
pinched nerve.
Compressed nerve, yes.
So there are two different types of nerve compression. There's mechanical compression, which is actually something pushing on the nerve and compressing it. And then there is chemical compression. So inflammation around that nerve, which is compressing it, restricting it, irritating it, and kind of giving you the symptoms down into the extremities or down in other parts of the body.
I'm going to stop you there. So what, if I'm watching, I don't know anything about this, what kind of symptoms are we talking about that I might have that might actually be some type of nerve compression? Can you explain like what I might feel?
You might feel that like sharp shooting kind of electric feeling down the arm, stabbing, pinching, down into very specific fingers, toes, areas of the arm or forearm. You might feel numbness, tingling, kind of like your hands about to fall asleep, parts of the body about to fall asleep. And then of course you'll probably feel some pain into the neck, low back, or wherever the actual nerve root itself is irritated. So lots of different symptoms, and mostly coming from the spine itself, but you'll feel it in other parts of the body kind of as the nerve is irritated.
So what kind of conditions would be associated with that, like with actual, nerve compression or irritation, let's say?
Okay, so nerve mechanical compression itself could be a variety of different things. So degeneration in general can compress the nerves on either side as you start to form bone spurs. It's your body's natural reaction to altered biomechanics, whether that's sitting all day, repetitive motions. Your body is laying down bone in areas where it's not necessarily supposed to be, so it can compress those nerves there. You can also have a disc herniation, or slip disc as people like to call it. That's in between each of the vertebrae here. As the disc kind of protrudes out, it can push actually into those nerves coming out on either side of the vertebrae and compress it that way. Chemically, you'll have inflammation. So this can be honestly anywhere in the body, whether that's in the spine, somewhere in the periphery. A lot of people talk about carpal tunnel syndrome. That's exactly just compression, irritation, inflammation around those nerves that's irritating it.
Right. So great explanations. Now, so it's good to understand too, a lot of times when people will say like I have a pinched nerve, they don't actually have a pinched nerve. So one of the common things is someone will say, oh, I woke up in the morning and my neck is kinked, and if I turn it, it hurts a lot.
Right.
And usually, and they will call that a pinched nerve. And it's not a pinched nerve. What it is often,
you can definitely feel like that nerve
it can
being
feel,
pinched.
yeah, absolutely. It's a pinching feeling,
Yes.
which is a good descriptor. Is that in the spine here, at the back of the spine are where the joints are, where the vertebra come together. So if some of these joints are irritated and get inflamed, whenever there's pressure on that joint, for instance, if you were to turn your head towards and compress that joint, you would get the pain that would almost prevent you from continuing the movement. So that's a really common thing that might be called a pinched nerve. Another place, we can't see it on this model, but in the upper back, the costovertebral and costotransverse joints. In other words, where the ribs attach to the spine.
Yes.
Very common. If that gets inflamed, you'll feel a pinching or a burning sensation. It may even cause some radiation spilling into the arm, numbness and tingling.
Yep.
People will think that's a pinched nerve.
Of course.
A lot of the times we can sort of differentiate and diagnose partly on our exam findings, but also on the symptoms. So I actually had a new patient this week who was complaining about numbness to the thumb and first and middle finger. So these three fingers. And of course, the distribution for that is the median nerve. Now, so that could mean that nerve is being irritated or impeded at the wrist, somewhere in the forearm or the neck, or very commonly a combination of things, of those areas, which was known in the literature as double crush syndrome, which is that if there's some nerve irritation as the nerve exits the spine at the neck, and then a person has a job where they're like typing all day and that median nerve pierces the pronator teres muscle and it's getting pressure on it there, then we get the symptoms into these 3 fingers. Again, very often for these things, the symptoms won't be there 24/7.
Right.
So they might come.
It kind of comes and goes.
Or they might feel it when they're doing an activity.
Yes.
Or again, this is really common, which is my patient this week was when she wakes up in the morning, those fingers are numb. So something's happening at night. Probably her sleeping position is getting her neck into a compressed situation, which is putting irritation on those nerves. And then she's waking up. And when she gets up and starts to move her neck around, some of that is relieved, and then the fingers come back to life. So the best way to, if you're having some of these symptoms or you don't know, really what's going on, get to a chiropractor. The specific tests that we can do can really sort out, what is going on and specifically come up with a plan of care to correct what is actually going on with yourself. Because you might not know. You might think, people throw the word disc around a lot as well. Is it a disc problem, a disc herniation? There's specific tests we can do. There's specific imaging we can use to determine, is it a disc problem? Is it a degenerative problem? Is it neither of those things, more of a functional problem?
Right.
So we can come up with the appropriate care.
Of course.
Okay. That's it.
That's it.
There's nothing else to say. So again, if you're having pain down an arm, numbness and tingling of fingers, pain down a leg, sciatica type things, get to a chiropractor and we can find out what's going on for you. So,
come see us,
We'd
get
love
your
to help
proper
you.
Diagnosis. Google's great, but
Absolutely. We're a little more specific.
If you have multi-symptoms, kind of different places, we can pinpoint exactly what's going on in those different places and then manage accordingly, a care plan for you.
Absolutely. Thanks for watching. Please be sure to like and subscribe. If you have any other topics you'd like us to cover in future videos, please let us know in the comments. We will see you
in the next Chiro Coffee Chat.
Absolutely. Have a great week.